This is my small talk. It's going to be altered mental states in children erasing course. So special thanks to Dr. Khan, Dr. Rochelle, PEM faculty, all our small talk team. I don't think anyone is here. So let's start with the case. We got a 7-year-old male present to the ED with the complaints of altered mental status. HPI presented to ED, Drosin as altered mental status and ataxia. No past medical history. Physical exam wise, blood pressure is at the lower limit of normal. Heart rate is 100. Generally drowsy, slow to respond to questions, appear altered and slurred speech. How do we approach this patient in the ED? Can anyone say?
I guess like history kind of tells you, I mean, do they have a few days of a URI? They're really dehydrated? Is there stuff in the household that they could have gotten into? Are they like having fever? Maybe they're like meningitic. First things that would kind of go down.
Absolutely. So we approach this patient just like our regular trauma patients. We do primary survey. Our general ABCD approach, make sure that the airway is intact, oxygenating well, breathing is okay, circulation is intact, no signs of shock or nothing like that. Then we see if the patient is obtunded, we have any concern for anything. We can give an Narcan 1 dose if we think like there may be a possible narcotic or anything involved. After initial stabilization, vitals are normal, then we will move on to secondary survey. We do like detailed exam. We get a detailed history, then we move on to labs. Make sure we get a blood glucose level, make sure it's not a hypoglycemic episode. We get blood gas, electrolytes, liver function, all the basic blood work, ammonia, lactate level, any toxicologic stuff like salicylate, acetaminophen, and then we will move on with that. So what are some differential diagnoses that we can think about when somebody present with the altered mental status? Anything? Absolutely. What else? Yes. Anything else? Yep. Okay, so when we categorize this based on metabolic, we could have intoxication, like metabolic alcohol. We can have insulin, hypoglycemia. If a child has some inborn errors of metabolism, this could present like that. We can have uremia. The next one, neurologically, we could have a seizure, stroke. If a sickle cell patient can have stroke, vascular issues, we can have some tumors. Toxicologically, we can have some overdose, we can have toxins. Infectious-wise, we can have sepsis, meningitis. Trauma-wise, if it's a head injury, fall, trauma, those things can present with altered mental status. Psychosis and GI stuff. In kids, we can have intussusception and they can present with altered mental status. So today's our topic is cannabis intoxication. So the main ingredients in cannabis is delta-9 THC. There is two one actually, THC and CBD. So there is two receptors that is mainly are CB1 and CB2. CB1 receptors are mainly in the central nervous system. This affect with the main cognitive functions such as learning, memory, emotion, all those things. And CB2 receptors are primarily in the periphery. They helps with influencing inflammation and immune response. And the CB2 receptors action is mainly the medical purpose of marijuana for some cases. But CB1 receptors mainly act with cognitive functioning. They are mainly G protein linked, leading to decreased neurotransmission. Synthetic cannabinoid ingestion cause mainly an action in CB1 receptors, and that can be more potent action compared to natural ones. So when people have a synthetic cannabinoid overdose, that could be like more potent effect comparing to regular ones. So when we obtain, as we discussed before, when we obtain the labs, if you are getting a toxicology screen, the UTOX 5 that we order, that doesn't include cannabis. So we need to order it separately if you have high suspicion for a child presenting with potential cannabis overdose. As we discussed, main functions, cognition, memory, and coordination, and also have some disorientation, memory issues, panic, anxiety, physical signs like tachycardia, ataxia, lethargy. Could be respiratory insufficiency and can, if it's severe overdose, can lead to coma. American Academy of Pediatrics, this paper was published in American Academy of Pediatrics. This is a study that they've done during this period from 2017 to 2022. They looked into the legalization of cannabis use. In 2017, it was 8 states and Washington, D.C. However, by 2022, that was 18 states allowing adult use of marijuana for recreational purposes. And the same study found that there has been a consistent increase in pediatric edible cannabis exposure over this 5-year period of time. And there is significant toxicity noted. So this point us to be aware of increased accidental exposure to cannabis in kids when we work in the ED. If somebody present, it's always good to have that differential in our mind for having to look for cannabis intoxication along with other causes that we look for. The New York Times article published, they are saying there is this was published in 2023, and then they found that under 6 children have a rapid rise in cannabis intoxication. That's also noted after more legalization of cannabis products. As per this paper that we just saw, they looked into this toxicological data from national database over that 5-year period, and then they grouped the clinical symptoms that noted during this cannabis toxicity. However, can anyone say what the symptoms that we usually see in kids with cannabis intoxication? We saw a few of them already. However, what are the other ones?
Drowsiness.
Yep. Okay. Neurologically, we can have CNS depression, coma, ataxia, agitation, seizure. Depends on the severity of the ingestion, which products that they took compared to synthetic products, compared to the natural one, how more potent effects or can have severe effects. Cardiovascular effects, tachycardia and hypotension. There is some cases saying there is hypertension too, it depends, but mostly we can see hypertension. GI effects such as vomiting and nausea. Ocular effect, mydriasis and conjunctivitis. However, this is mainly depends on what the co-ingestion or if the product that they accidentally or whatever way they ingested, if that product was mixed with some other products, this could be vary. So it's mainly depends on what they ingest, how much dose they ingested. Respiratory wise, we can see respiratory depression, and it mostly seen in severe cases. Mild cases, their breathing won't get affected too much, but severe cases. During this 5-year period of time, when they looked into the cases, they didn't see any death reported during that period. So that doesn't mean that it cannot happen, but it depends on, as we discussed, it's how severe is the ingestion. This is another study looked into age-wise, what's the chief complaints and what are the vital signs abnormalities we've seen. We could see here mainly like Despite the difference in ages, most of the children are presenting with the altered mental status. That's what I seen in our case too. And then there is, most of them have tachycardia as one of the vital sign abnormalities. And then we could see hypertension too. Okay, is it cannabis safe during breastfeeding? So study shows mixed results. It can detect up to 6 weeks in breast milk. One study indicated slightly reduced motor development in infants who are exposed to cannabis products. And it's also linked to sudden infant death syndrome. And a few cases reported seizures in infant. And also these data that they looked into this during breastfeeding, the sample size were all very limited, only few patients that they could find, because they were mentioning that it's a social stigma, or parents are not willingly come out to express that I have a baby, I'm breastfeeding, and I'm still using cannabis products. So the sample size were really small. So they are recommending more studies need to be done just to finalize whether it's an actual findings. However, they are not recommending, studies not recommending use of cannabis while breastfeeding. So in acute intoxication, they find few cases of reduced LH and prolactin levels, and it's also users have a higher lactose and lower IgA levels in their breast milk. So what are the treatments that we can give when somebody present with the cannabis? If somebody done something, any pediatric ED, what do we do? Or what are the things? You guys have any experience?
Want to monitor it. May want to do lab if you're confused whether it actually is cannabis versus another toxin or something else, a different ingestion. And fluid dosage, just watching them, making sure that their mental status is complete.
Yeah, absolutely. So there is no specific antidote that we can give for cannabis. So it's mainly supportive treatment. So we just want to put them on a monitor, just stabilize them, ABC approach first, airway, breathing, circulation, make sure that none of those are compromised. And then we pretty much follow our trauma algorithm initially when we assess them. And then supportive management, you can give some hydration, observe them. If their vitals are stable, they're breathing normal, no other concerns, no trauma or anything that we can see, then we can pretty much observe them in the ED. Otherwise, we can use benzodiazepine if the child is agitated. This also works for seizures too. We can use benzodiazepine just to calm them down. If they have seizures, status epilepticus, any of those things happen, we may need to do further airway management. We might need to sedate them, intubate them just to protect their airway and just provide more support. If they have a cannabinoid hyperemesis syndrome, we can use this. Mostly comes in a regular usage, it's not an accidental ingestion cases. If a adolescent comes and they're using cannabis regularly and they overdose one day and they're without symptoms, we could give a haloperidol, which works well for that. Observation for 6 hours and admission. This time frame that I got from one of the articles that I read, 6 hours observation. However, they're recommending that observation based on what the condition that they're present with. When they're presenting, they were like having respiratory problems, or their heart rate is highly elevated, or their blood pressure is low. We are managing them with fluid, then they may need to stay longer. However, if their vitals are stable, they are alert, their mental status improved, and then they feel like they are safe with the parents, a good place to go, then probably we could send them home with parents and they can monitor them at home. They doesn't need to stay in the ED. But if their condition is not improving after 6 hours, we might want to think about admitting them for further observation. Report to poison control. This is another thing. We need to report this ingestion to poison control. And one thing I was discussing with the pediatric emergency medicine team here, they were saying social work consult. Some of our ED attending said they don't consult for all the cases to social work, because if the parents are willingly come out and say, hey, we had this one stored at home and then the accidental ingestion and there is no concerns, parents are, when you assess them, you see parents are, you can trust them and they will do the preventive measures at home and it is safe to go home with the parents and we can send them home. However, we don't have a specific age limit where they consult. I was talking to Dr. Khan, she recommended sometimes we consult if the child is under 12. She usually say it's recommended just to consult to social work just to make sure that they have it's a safe to go home. So it depends on what's the situation, how we feel when we examine them, assess them, when we talk to the parents. And if we have high suspicion that there is something else or the child may be potentially risk to go home, then we might need to consult social work. So we saw that there is no antidote or there is no specific treatment for cannabis use. So prevention is the best thing that we could do. As per all the studies that I referred, the main cause that I found is like accidental ingestion. It's not like somebody feeding or it's just like it's a purposefully doing it. Most of the time, small kids, this is accidental ingestions. And then these things are made in like, see the really beautiful, colorful packets, candies, cookies. So it's curious for them to just to try it. So prevention is the one thing that we could do just to avoid this exposure. And for that, packing and storage practice is one thing recommended by American Toxicology, College of Medical Toxicology. In 2019, they stated that changes in cannabis packing and home storage practice to reduce the incidence. That's a recommendation. However, they said the study is still shown to be showing that increase in accidental exposure. Most exposure happen at home. Almost over 90% of exposure happen at home. So educating parents is big thing. Just to control this one, keeping cannabis in a safe storing places and away from kitchen areas. And then this, one of these, the parent guide to preventing underage cannabis use. There is few states have these booklets that are available online. So this is a good guide for parents to read. I think you can Google it and find it if somebody comes and you wanted to give them one of the reading materials. It's a good resource. Public education is a big thing. So our case, just to summarize our case here. So observed in the ED, positive for urine THC as we expected, was stable after 6 hours, so we discharged with some education to parents. And these are my references. Anybody have any? Thank you.